recommend feeding him?
The muscle wasting is very common in Cushing's horses, and this muscle, the muscle runs on their back, is supposed to be at or above their spine. Obviously he's way down. And the same thing here is this should be round, even on Arabian cross, this should be round. So this muscle, for lack of a better term, is deflated. So what cures that is not calories, it's amino acid balance. And we talk more about amino acids than we do about protein. And if the amino acid balance is not correct, this is not going to come back. So what we do, and might even go 3 pounds of Essential K with him to jumpstart the program. And then, he's about a body score 4 because his ribs are showing a little bit. So he needs some calories here, but he needs amino acid balance here. So how much common ease are you feeding him now?
He's on 3 pounds.
Okay, I would say I would go 3 pounds of Common Easy, but I also add 3 pounds of Essential K.
Okay.
Short term to get this build back. Once he's fixed, then you could back off on the Essential K. But that's going to help rebuild this muscle. What we do is manage these guys with a high amino acid.
Okay.
Not more protein, but a high amino acid.
Okay.
We call our product Essential K. And then I also view these guys as growing again.
Right.
So we need to redevelop this and this just like in a baby.
Right.
So my suggestion is we go to 3 pounds of Essential K a day and stick with the 3 pounds of Common Easy. And he's about a body score 4.
Yeah, I'd agree with that.
And that's what the Common Easy will do, is help build weight.
Okay.
But to get this back, we need the amino acid concentration to be different. So we've done this dozens of times with Cushing's horses.
Sure.
And at his age, I would be very surprised if he didn't respond.
Sure.
But it's going to take 6 to 8 weeks to see a profound difference, assuming that there's no underlying medical reason for this.
Right.
But
I know.
when their antioxidant levels are higher,
Right.
which is selenium, vitamin A, vitamin E, if you look at the levels in Essential K, they're really high. So there's no need for any non-medical supplements.
Right.
But that will also help his immunity.
Okay, great.
So
Great. So go ahead and start
it's
that.
tried and true.
This too.
It's
Yeah.
tried and true.
And it'll help all that?
Yeah, it'll help this too.
Okay, well, great. So I'll be going to see Dan at Farmer's Supply today to get that.
And I would, start slowly, like keep it with 3 pounds of Common Easy and just add a pound. He'll have these little cups to measure it.
Okay.
That's half a pound.
Half a pound.
So I would do a pound a day for 3 or 4 days, then add another
Right,
pound and then another.
Okay.
Take it up slowly, because if he is compromised, we don't want to push him too hard too fast.
No.
Okay.
But it'll take,
Yeah.
and I'm fairly confident, even if he was 20,
Right.
I think that's fixable over
Okay.
time.
Yeah, I certainly agree.